कि सर पे टोपी है, मत कहो कि सर पे टोपी है, कहो सर पे हमारे ताज है, कहो सर पे हमारे ताज है.
Dental hygienist, because what she has experienced was completely preventable, right? Tooth loss is not because of age, but more because of neglect or not able to afford dental care, which is a main reason why many people don't attend going to the dental offices. But professional that you are seeing is, have you had any changes in your mouth that you've noticed? Have you lost or have any sensitive teeth? Because sensitivity is also a sign that there is something happening in the mouth. Dental diseases is usually painless, and we don't notice this happening until it has progressed to a significant amount of damage, right? If there's sores in the mouth, if you have sores in your mouth, those usually should go away within 2 weeks. But if there is a sore in the mouth, this is something you would like to show and bring up to your dental office, because sores in the mouth can also lead to other lesions of oral cancer, which is also prevalent and detected early if we go regularly to the dental office. Lumps and bumps and swellings in the mouth can also be a sign that there's dental infections. When you go to the dental office, the most important thing that we should do is ask for help. If you find you're not able to clean your teeth properly twice a day, find ways to help maintain it. Brushing twice a day is important, and also addressing dry mouth. Many patients experience dry mouth and not know that it is a problem, and will maybe compensate by taking candies or mints, drinking water often. These can also be helpful if you talk to your dentist or dental hygienist about these concerns. Bringing a list of any medications to your dental office as well is really important, because the medications that we take can impact the amount of bacteria that can be present in the mouth when the mouth is dry. Has anyone experienced dry mouth quite a bit? Yeah. So eliminating the source of infection is really key. Improving our oral hygiene practices and rinsing the mouth with a mouthwash can help promote healing. There are many types of dental products that are out there that we can help improve our dental daily care, such as electric toothbrushes. Manual toothbrushes are great, but many times patients don't have the ability to get the hard to reach areas very well. So has anyone used an electric toothbrush here? Yes? Yeah, Sonicare, very good. It is a very good investment to invest in an electric toothbrush to help remove the bacteria in the mouth. Bacteria within 12 hours of not brushing, so let's say 7 o'clock in the morning, you didn't brush until 7 o'clock at night, there is over 600 billion bacteria in the mouth that has already accumulated. Good bacteria and bad bacteria. But the more times we brush during the day, the more less effect on the mouth for inflammation. Bacteria is naturally in our mouth. However, when there's too much during the day and is not removed, will cause significant damage to the bone structure and supporting teeth, causing tooth loss. There are other types of ways to clean in between the teeth, which many do not do as effectively as I see in practice with dental floss. There are water flossers or little interdental brushes that are really great. I'm not sure if anyone has used a water flosser. Yeah, water flossers are a great way, especially if you have arthritis or cannot reach back teeth well, right? Using these advanced brushes and products can really make a difference in making it easier to maintain in between during the day. And with the water flossers, all you have to do is add water to the unit, and you never run out of floss, right?
Yeah.
Very, very easy. Also, the next thing I would talk about is cleaning the tongue. Many times is the one place we forget to clean is the tongue. And this is where it harbors the most bacteria. 80% of the bacteria lives on the tongue. So I believe there are many tongue cleaners out there that are good. Have you used a tongue cleaner before? Yes. Wow, very nice. Good amount of people using a tongue cleaner, and that is, you can see the amount that comes off when you use that, right? So those are some excellent ways to remove the bacteria in the mouth daily. For those who wear dentures, many people wear dentures to help replace missing teeth or have bridge work or implants. Denture care is important if you do wear dentures to remove them daily, because the bacteria will also accumulate on your dentures. And because we still don't have teeth, it still does require cleaning on a regular basis. So avoiding using the abrasive toothpaste on it, but more soap and water would be helpful, or the denture cleaners, the Polident tablets are a good way. Avoid putting it in hot water because it might melt the denture, right? And keeping it clean in the morning after it's been soaked, brush it off. Bring it to your dental appointments. Those are really good ways to see if it's still fitting. Because when your denture has been longer than maybe 5-10 years, the bone that it was holding onto starts to shrink and can affect the way you chew, can affect the way you speak, and can cause sores in the mouth that develop over time, right? And can develop fungal infections, right? So the next topic I wanted to discuss were those who have diabetes. Diabetes is a source that can be affected with inflammation that is triggered by the bacteria in the mouth. Early detection at the dental office can happen, and as I have been practicing, I have noticed many patients bleeding, not normally during a dental cleaning, and this is a sign that those who have diabetes should follow up with their family doctor to help control their blood sugar. So if you do have diabetes, one of the most important things to bring up to the attention of your dental professional is your blood sugar, and let them know how well managed it is so that you can reduce your risk of infection and also reduce the risk of tooth loss. As we know, diabetes can compromise your immune system and you are more prone to infections more easily. So bringing your blood sugar levels to your dentist is important. Lastly, I wanted to talk about was vitamins for our oral health and how our diet can affect how our mouth tissues heal. Vitamin C is an important vitamin to have regularly to help build collagen in the mouth, but also increase your immunity. The risk of sensitivity can happen if you take too much vitamin C. So protecting your teeth, if you do have a lot of juice, to use the right toothpaste, because toothpaste helps protect against those concerns, right? Vitamin B, which is found in nuts, meats, and poultry, can cause, if not enough, can cause a deficiency in sores in the mouth. So some sources of a vitamin B is pasta, bagels, spinach, almonds, yogurt. Those are all good sources to try to eat to help support your dental health. Vitamin A, which helps with dry mouth, which can be found in eggs, fish, spinach, kale, apricots, pumpkin, and carrots. Sweet potato are good ways to find vitamin A. The next topic I wanted to talk about was dry mouth. As I had previously mentioned, those who have dry mouth can be derived from those who are taking medications, who have had chemotherapy, and over time with age, our mouth becomes dry. Sometimes many seniors especially will have a glass of water next to their bedside table to help with the dryness in the mouth. Some medications that can trigger.
Send me through email. I can.
Oh, okay, sure.
Thank you.
Thank you. Sorry.
Take your time.
Okay, I will see. You continue with me.
Okay. So when it comes to the medications, as I was mentioning, many medications can cause dry mouth, such as blood pressure medications, antidepressants, anti-anxiety medications, decongestants for allergies, pain relievers can cause dry mouth. Those who have Parkinson's, the medication can also dry out the mouth. And those who are on inhalers, especially for those who have asthma, they use a powder type of device. Rinsing the mouth after each use is a very important way to avoid fungal infections, because fungal infections can happen in the mouth and cause even more dryness. When you speak to your dental professional, there are, or if you would like to talk to me after the presentation today, I can go over a few types of mouth moisturizers that are helpful to help keep the mouth hydrated. A lot of times, many of us will pop in a candy, but the candies can also contribute to cavities, right? So you want to use a moisturizing mouthwash or products that contain xylitol. It's like a natural sugar that stimulates saliva. And these can be found in many health food stores or in some grocery stores in the health food section. called xylitol. But staying hydrated, keeping the room humidified. If you have a humidifier at home, especially in the winter time, it can get worse. But if you have a little small humidifier at home, it can help keep everything comfortable. Because when there's no saliva in the mouth, bacteria will grow more. Everything sticks to the teeth when the mouth is dry. Food that you chew will stick to your teeth more and will initiate the cavities to start, right? Makes swallowing difficult, speaking difficult, and the tissues in the mouth can develop little cracks on the sides a lot more faster when the mouth is dry and lead to sensitivity. Sometimes with those who have dry mouth can have an altered sense of taste where their taste is different because there's no saliva there. They don't taste things as much and will over season their food. And that can, change the way your diet is. So chewing hard, crunchy foods, if you are able to, will also stimulate saliva, like carrots, celery, anything that's fresh would be ideal. When you do have dry mouth, the most important thing to do is to use the right types of toothpaste to protect the teeth, such as fluoride toothpaste. Many toothpastes are in the aisle, and there's many to help with sensitivity, dry mouth, plaque control. Ice is a very good way if your teeth are not sensitive to moisturize the mouth and just slowly allow the mouth to stay hydrated. If you do smoke, do cut out or reduce the amount of cigarettes to avoid the dryness in the mouth, but also avoiding the things that can cause dry mouth throughout our days, such as caffeine that is found in coffee and tea. Those can also increase your chances of having dry mouth. And many of us cannot live without coffee or tea. So, drinking 2 glasses of water after you have a tea or coffee would be the best to keep yourself hydrated. And lastly, I just wanted to share that, the mouth is a gateway into our body. This is the one place that we can start to keep ourselves healthy. And during the pandemic, we realized, lots of things can change over time. And if we can prevent disease in the mouth, the number one source of where all infection can start, we can live a lot healthier. So thank you for having me here today. I'm sorry. I also did bring some samples. I brought some toothpaste samples for everybody. If I can leave them here with you all, you can help yourself to some to help with the sensitivity, as I mentioned, or mouth rinses. Okay?
Should I ask if anybody have any questions?
Yeah. Did anybody have questions that they wanted to bring up? Yes.
I have a question, but it's a personal question. Can I ask you
Yeah,
afterwards?
absolutely. Yeah.
Okay,
Thank you. No problem. Thank you.
Thank you, Rachel. It was wonderful presentation, but we had a technical problem that we could not bring it on the PowerPoint. I think we'll have to redo it for the reason. Because most of the things, if you cannot understand the language, you can understand it from the pictures. This is what she told that कि आपको अपने दांतों की सेहत का पूरा ध्यान रखना चाहिए क्योंकि ये कई बार बहुत डेंजरस हो सकती है और यहाँ तक कि ये जानलेवा भी हो सकती है बहुत से पेशेंट्स में ये देखने को आया कि दर्द दांत से शुरू होती थी, दिमाग पे चली गई और उसके बाद अफेक्ट किया और डेथ हुई। ये बहुत जरूरी है। वो ये कहते हैं कि हर 6 महीने बाद डेंटिस्ट के पास जाना चाहिए, हालांकि यहाँ पर ये बहुत कॉस्टली ट्रीटमेंट है, आम आदमी अफोर्ड नहीं कर सकता। और मैं ये कहूँगा, इनसे रिक्वेस्ट करूँगा और सिटी से भी हम रिक्वेस्ट करेंगे, प्रोविंस से रिक्वेस्ट करेंगे, क्योंकि ये प्रोविंशियल हेल्थ सिस्टम जो है वो हर प्रोविंस का अपना होता है। और अगर ये चाहें तो डेंटिस्ट्री की बहुत सी आइटम्स जो हैं वो इंक्लूड कर सकते हैं। वो उसके लिए जो प्रोविंस है वो अपनी हेल्थ में इंक्लूड कर सकता है। कुछ इंक्लूड किए भी। आपको उन्होंने कहा कि 1000 का वाउचर आपको थ्रू आउट लाइफ मिलेगा, जहां आप यूज करना चाहें आप कर सकते हैं। लेकिन जब आप दांत लगवाने जाते हैं तो वो कितने कॉस्टली बैठते हैं, उसका कोई इफेक्ट नहीं होता। तो दांतों की सेहत अपनी हेल्थ के लिए मेंटेन करना बहुत जरूरी है, क्योंकि कई बार स्लावा जो है वो आपका हेल्थ के अगेंस्ट होता है, कुछ हेल्थ को फेवर करता है, ड्राई माउथ हो जाता है, ब्लिस्टर्स हो जाते हैं, वो फट जाते हैं, बहुत पेन होती है और ट्रीटमेंट में बहुत ज़्यादा टाइम लग जाता है। तो बड़ा टाइम भी आपको, क्योंकि ये सब जो है वो आपको अपने तरफ से पेमेंट करनी पड़ती है, तो हम अवॉइड करते हैं। बट नथिंग इज मोर इम्पॉर्टेंट देन योर ओन हेल्थ। किसी भी कॉस्ट पे हो वो आपको मेंटेन करना जरूरी है। आज आपके कोई भी क्वेश्चन हो दांतों के बारे में, और मैं तो ये कहूंगा रिचेल, व्हाट हैपेंड दैट माय टीथ ऑटोमेटिकली दे आर ब्रोकन, यू नो। पता ही नहीं चलता कि कैसे वो खाना खाते हुए आप अब नहीं, पहले मतलब शुरू में तो कैल्शियम की कमी हो सकती है, कुछ ऐसी चीज हो सकती है कि क्या हो जाता है, कैल्शियम की कमी हो सकती है। और कैल्शियम ज्यादा लेना जो है वो भी किडनी के ऊपर इफेक्ट करता है। आप कैल्शियम ज्यादा भी ना लीजिए, उसकी भी एक मिकदार होती है। साइंस ने बहुत तरक्की की है, वो हर चीज के प्रोपोर्शनल बता रहे हैं आजकल कि इतना होना चाहिए, इतना हो चाहिए। जब हमारा मेडिकल होता है साल में एक बार जरूर होता है, वैसे भी जब हम जाते हैं तो वो मेडिकल के लिए पहले कहते हैं कि अपना ब्लड वो लेके आइएगा, टेस्ट करवाइएगा, ब्लड टेस्ट लेके आइएगा। तो उसमें वो सारी प्रोपोर्शंस को देखते हैं और उसके बाद जो कमी होती है, जो ज़्यादा होता है, वो सब आपको इन्फॉर्म करते हैं, टाइमली इन्फॉर्म करते रहते हैं। तो किसी चीज़ की भी कमी हो उसको आप पूरा करिएगा, ज़रूर कांटेक्ट करिएगा। इनका ब्रैम्पटन में है, मैंने आपको पॉम्फलेट दिया था, उसके बाद फिर आपको बताएंगे कि जहाँ अगर आप वहाँ ब्रैम्पटन बड़ा नज़दीक है, जा सकते हैं। जो ब्रैम्पटन में रहते हैं वो इनसे कांटेक्ट करें। और मैं फिर इनसे एक बार रिक्वेस्ट करूँगा कि हम कभी, जब हमारा एक टेक्निकली जो आज हमें प्रॉब्लम आई, जो प्रेजेंटेशन थी, प्रेजेंटेशन से बहुत सी चीज़ें सॉल्व हो जाती हैं, समझ आ जाती हैं, वो ज़्यादा अच्छे तरीके से फिर हम कभी करेंगे इनका। तो हम आपका बहुत बहुत धन्यवाद करते हैं। थैंक यू वेरी मच। इट वॉज ए रियली वेरी वेरी स्टैंडर्ड एंड वेरी हाईली एप्रिशिएबल प्रेजेंटेशन। मैं अब डॉक्टर पटौदिया जी को रिक्वेस्ट करूंगा कि वो ज़रूर आके बोलें, क्योंकि वो हमारे सीनियर्स की हेल्थ के लिए कमेटी के हेड हैं और वो आपको थैंक्स भी करेंगे और इसके बारे में, डेंटल हेल्थ के बारे में बात करेंगे। जी,
I'd like to thank for you giving a very good presentation, very good knowledge about what should be done to keep your oral cavity very healthy. And as you know, as you all see, you may or may not know, my daughter is a dentist. Now she is dental anesthetist, so she's on a bigger scale, specialized in anesthesia. But one time she was, and you know, when you get together, when you have family who are dentists and doctors, sometimes we tend to talk about the patients without naming because we don't know who they are. So she told me once that dad, this lady who just arrived from India, and she came to see her, and so he explained to her that you have to brush your teeth twice a day. You have to brush your teeth twice a day at least, and then you have to have what you call flossing. So I guess, just as he said, there was not good oral health in Philippines. Is the same, although much improvement has happened in India. But when I came in 60s, I remember for that time, there was not a very good dental care. People, as a matter of fact, did not know about flossing at that time. So this lady, so she said, you have to floss. We need flossing. And that's what I am sure she is also trying to impress, that to keep our teeth healthy. From medical point of view, if you are smoking, if you are जैसे अपने क्या बोलते हैं यूपी के हैं और भी जो हैं खैनी खाते थे, आपने देखा होगा हाथ में थोड़ी सी वो क्या बोलते हैं बेड को लेके ऐसे ऐसे मसल के लगाते थे, and they were preparing themselves for oral cancer. So those things, smoking, drinking alcohol, we have to stay away from that. Achha. She talked about cleaning the tongue. But that in India, I can tell you, from thousands of years, we know about cleaning the tongue. Because जीभी तो आपने सब ने सुना होगा, यहाँ पर कोई भी ऐसा नहीं है जिसने नहीं सुना कि जीभी क्या होती है और कैसे अपने क्या बोलते हैं टंग को साफ करते हैं. So that's one thing we have from long time. दूसरी चीज, another thing which we have forgotten or we don't want to accept, or we have modernized ourselves so much and it's not available here also. लेकिन सबसे हेल्दी आप लोगों ने देखा होगा, आपके दादा दादी नाना नानी दातुन करते थे, नीम का दातुन करते थे. That was the most healthy type of brushing your teeth. नीम के कारण केवल आपकी दांत और मसूड़े ठीक नहीं होते थे, आपके मुंह के अंदर जो भी सारे बैक्टीरिया थे खत्म हो जाते थे. तो few of the things we have been doing, लेकिन आजकल क्या होता है कि हम बोलते हैं खैर यहाँ तो मिलते नहीं है, नीम नहीं मिलता है, फिर भी we have modernized too much. लेकिन simple things जैसे इन्होंने कहा brush your teeth twice, always क्या बोलते हैं floss your teeth. दूसरी चीज, जिनको जो डेंचर पहनते हैं they should clean up every time, क्योंकि टैबलेट आती है, आप डेंचर के अंदर पानी डालिए, वो टैबलेट रखिए, and that itself will sterilize, more or less clean all the bacteria. As he said, there are billions of bacteria in our mouth. There are very good bacteria which we want to keep. There are bad bacteria we want to avoid or kill them. So that's the reason. If you are wearing denture, you have to do that. If you have healthy teeth, that's very good. अच्छा, इसका एक एग्जाम्पल मैं आपको बता देता हूँ. When we came to Nova Scotia, this is just a real story. When we came to Nova Scotia, first time Chanda went to the dentist. And Nova Scotia के अंदर at that time, I'm talking about 60s, we came in 1963. Back, by the age of 20-25, as she said, her mother already had denture. Most of the Nova Scotians had dentures already. So when Chanda went, the dentist was surprised and he said, please take out your denture. He said, what is denture? Because he didn't know what denture meant. But I know to beat, he said, no, these are my teeth. So the dentist was so much surprised, he felt each teeth, उसको हिला ला के देखता है कि इसके खुद के ही तो है ना. Not only that, उसकी ऑफिस में जो 2 or 3 they were dental hygienists, he called them, come and see. This lady has all 32 teeth. So what I am trying to get at is, मेरा कहने का अर्थ ये है, और जैसे इन्होंने भी बताया कि हम जो कुछ खाते हैं, पीते हैं, स्मोक करते हैं, ड्रिंक करते हैं, उन सब के कारण ही हमारा हेल्थ ठीक रहता है. So you have to start from your mouth. You keep your mouth healthy. You keep your क्या बोलते हैं teeth healthy. You keep your gums healthy. You keep oral cavity जो होती है उसको healthy. Then everything will take care of it. Your gut health जिसको बोलते हैं intestinal health will get better. And as you know, जो कुछ हम खाते हैं, what you eat, that's what you get, जिसको कहते हैं अपने. तो जो भी कुछ खाएंगे उसका प्रभाव हमारे सारे शरीर पर पड़ता है, क्योंकि दांतों से आप जितना चबाएंगे, हमारे गुरुजी कहा करते थे कि आप एक नेवला मुंह में लेते हैं तो आपके 32 दांत है ना, you have 32 teeth, so you chew 32 times at least. What he meant was, and what the doctors also say, what the dentists say, and what she will say, is the food which you are eating, because the intestine doesn't have teeth. The teeth is only in the mouth. So you make a gruel, जिसको एकदम से almost liquid आप कर देंगे अपने माउथ में, then when it goes into the intestines, it is absorbed, goes to the blood, and goes throughout the system and helps you there. So that's one of the things. Now talking about आज, thank you very much. This is about oral health care, but I want to talk about something more. ये देखिए हमारे एक भाई और एक बहन, उनका डिमाइज हो गई, वो चले गए. तो चले जाते हैं, दोनों के दोनों किससे गए? हार्ट अटैक से. तो हार्ट अटैक जो है हमारे साउथ एशियन के लिए, हम जो इंडिया से आए हुए हैं, whether we are settled here or not, for how long doesn't matter, we have the propensity, we are liable to get diabetes, we are liable to get high blood pressure, we are liable to get more cholesterol, and because of what we eat, we are liable to get big tummy, all fat around us. So those are the things which are avoidable. और आप जिस शहर में रहते हैं, जिस ऑन्टेरियो प्रोविंस में रहते हैं, we are lucky to live in the best province in the world, I tell you. The reason what मैं आपको इसलिए कह रहा हूँ कि यहाँ पर जो हेल्थ केयर है, बेसिक हेल्थ केयर है, बेसिक ही भी नहीं, एकदम एडवांस हेल्थ केयर है, that is only for your asking. You have right to ask that. But लेकिन हम लोग क्या करते हैं, सुस्ती के कारण जाते नहीं हैं. यहाँ पर आप डॉक्टर के पास जाएंगे, $1 भी नहीं देना पड़ेगा. आप ब्लड टेस्ट कराने जाएंगे, आपको एक पैसा भी नहीं देना पड़ेगा. आपको अगर और एडवांस कोई टेस्ट कराने पड़ता है, एक पैसा भी नहीं देना पड़ता है. तब फिर मेरी समझ में नहीं आता है कि हम लोग हर साल अपना हेल्थ चेक क्यों नहीं करवाते. अच्छा, दूसरी चीज है कि इफ यू हैव ए फैमिली हिस्ट्री ऑफ हार्ट अटैक, whether it be your parents on your mother's side or on your father's side. Then you are liable to get more diabetes, you are liable to get more high blood pressure, you are liable to get more heart attacks. So, when you go to the family physician, sometimes the family physician is going to say, even though you tell them that, okay, I have this long history of heart attack, sometimes they are that busy that they may overlook it or they don't take care of it, but then you have to insist, and it's your right. It is your right. You have to insist. I want to go to a heart specialist because my parents, on whatever side they had this heart problem, then only the heart specialist is going to get you more tests in the case of stress test or echogram, कई रकम के हैं, and those are all free, no cost, not a single penny cost to you. So that's why I'm saying, please, 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 अगर आपकी फैमिली हिस्ट्री बहुत ज़्यादा डायबिटीज़ की है, हार्ट अटैक की है, हाई ब्लड प्रेशर की है, तो प्लीज इंसिस्ट on your family physician that he sends you to the specialist and especially to the heart specialist who is going to take care of you. तो इसके साथ मैं यही कहना चाहता हूँ, टेक केयर ऑफ योर हार्ट एंड वैक्सीन की जरूरत होती है, वैक्सीन लीजिए। और अभी भी क्या बोलते हैं, कोरोना खत्म नहीं हुआ है। Those who have had 3 doses, if you are क्या बोलते हैं already ready, and जो 5 महीने आपको हो गए हैं, तो take the 4th dose. So please do that.
Monkeypox now, sir. What is new monkeypox now?
Monkeypox वैसे है। Let's take care of monkeypox. Thank you.
इन्होंने मेरे लिए जो बोला ना दांतों के लिए, मैं जब गई डेंटिस्ट के फर्स्ट टाइम तो एक भी कैविटी नहीं थी, क्योंकि इंडिया में हम कैंडी और ये सब रिजल्ट इतना खाते नहीं थे, तो एक भी कैविटी नहीं थी। तो सबको बुला के दिखाता है कि इस उम्र में देखो इसके एक भी कैविटी नहीं है, इसलिए उसने वो भी सबको बुलाया। थोड़े दिनों के बाद यहाँ कैंडी वैंडी मुंह में रहने से मेरे भी कैविटी हो गई थी। तो आपकी लाइफ स्टाइल से कितना फर्क पड़ता है, इट्स दैट्स सो ट्रू। तो ये जो हार्ट के बारे में बोला, मेरी फैमिली के अंदर माय फादर पास्ड अवे एट 54, so much heart problem, so every year I get my heart checked. So this is why आपकी फैमिली में क्या है वो भी, और वैसे अगर लिखा होगा तो सारा चेक करके निकलो तब भी यू आर ड्रॉप डेड। सो ये भगवान के ऊपर भी भरोसा रखना होता है। एनीवे थैंक यू।
बहुत धन्यवाद, थैंक यू वेरी मच। आप मीठा नहीं खाते हुए